You're about to hear from R Hales, a graduate of Columbia University Law School and licensed to practice before the Supreme Court of the United States. He manages an international health information privacy practice based in St. Louis, and he is author of all content in a software for HIPAA education compliance called the HIPAA E-Tool. He has a passion for connecting behavioral health workers to HIPAA compliance education and resources, and it's my privilege to have him here to educate you today.
Sure, I'd be happy to speak about what HIPAA is. It is a federal law. It is a national law that sets on a national basis standards to protect the privacy and security of individually identifiable health information, which is also called protected health information. And it comes from a statute that was passed by Congress in 1996. And that was a very broad statute. But one of the things that it did was it directed the Department of Health and Human Services to create rules. Those are administrative laws regarding the protection of the privacy and security of individually identifiable health information. Before that, there had never been any national standard. It takes a while to make those regulations. So the first rule, the privacy rule, didn't come into effect until 2023. So HIPAA has been in effect throughout the United States since 2003. It has been amended. The basic statute has been amended. A new rule has been added. So there are four basic HIPAA rules. The privacy rule, which is the fundamental rule, that's the rule that explains how you may use or disclose protected health information with or without a patient's authorization to use or disclose the information. It also explains the rights that each of us have to our own protected health information that is held by, maintained by healthcare providers. And the next rule is called the security rule. That has some very specific requirements that apply to protected health information that is held, transmitted, or maintained electronically. The security rule doesn't have what we call substantive law. The purpose of the security rule is to prevent a use or disclosure of protected health information transmitted or maintained electronically that's not permitted by the privacy rule. The third rule is the newest rule. It's called the breach notification rule. And that explains what a breach of protected health information is. That is to say, it's a use or disclosure or an acquisition or access to protected health information that is not permitted by the privacy rule. And the breach notification rule has very specific requirements, both explaining how you determine if your organization has had a breach and then what you need to do if you have had a breach in terms of notifying patients and also the Office for Civil Rights of the Department of Health and Human Services, which is the office that administers and enforces the HIPAA rules. And in the case of what is called a major breach, that's a breach that affects 500 or more people at the same time, you also have to report it to prominent media outlets in your region. And then the fourth rule is the enforcement rule, and that explains both the penalties that you may be liable for if you violate the HIPAA rules. It also has a set of procedures as to how the rule is enforced using administrative law judges by the Office for Civil Rights. So that's HIPAA. Now, one of the problems is that the HIPAA rules are written in really in legalese that's difficult even for lawyers to understand as they go through it. And what has been my concern, and I've been involved with this for more than 20 years, since before the HIPAA privacy rule came into effect, because I represented large healthcare organizations, and I needed to be able to educate them about how to comply with this new rule. And so we developed steps. We broke the rules down into steps. And not only that, we broke them down into forms so that the workforce of a large organization, which must have policies and procedures, that's one of the requirements of HIPAA for very specific policies and procedures to comply with the HIPAA rules. But if you have the right steps or the right forms, by following that form, well, you don't have to go back to the policy and look up the procedures and so forth. But the thing that concerned me the most in 2003 was that it was really only the very large organizations that were making a concerted effort to comply with HIPAA. HIPAA covers what are called covered entities, and those are healthcare providers, health plans, and healthcare clearinghouses. And since HIPAA was amended in 2009, it also covers a group called business associates. And those are contractors that provide services to healthcare providers or health plans that require the disclosure by the provider or plan of protected health information. For example, organizations that conduct billing of patients or coding for submission to insurance companies, things of that nature. So in 2003, it was the big health insurance companies, the big hospitals that had the resources and staffing that really dug in to create HIPAA compliance programs. But I get most of my health care from smaller providers, like my dentist, my optometrist. And it was the smaller providers that I had the biggest concern about, and that includes behavioral health care providers. And so at most, back in 2003, what they were doing was maybe handing out a notice of privacy practices, but not following the HIPAA rules. And that not only could get the provider in serious trouble, but also for the patients. The patients were not afforded the protection of their own personal health information. Now, that's come to be a really important issue because medical identity theft is the fastest growing form of identity theft in the United States. And there are only two things that are required for medical identity theft, and that's the identity of a provider and the identity of a patient. And we see both of those exposed on the internet all the time by providers, including large providers, that aren't following the HIPAA rules that are easy to follow, and that if you follow the rules step by step, you can still do all of the marketing, all of the outreach, all of the patient engagement that we see causing violations on the internet and exposing patients to theft of their medical identity. Medical identity is, according to the FBI, worth at least 50 times more on the dark web than a credit card number or a social security number, because it's used to commit health insurance fraud and obtain prescription medications. The thing that is important to know is that the HIPAA rules are easy to follow step by step when you follow the steps. And the key thing is enabling you to know what those steps are and to have access to them. And if you do not follow the steps, well, then your organization can be in line for not only a HIPAA violation enforced by the Office for Civil Rights, but now there are new enforcers, among them private lawsuits. They figured out a way to maintain private lawsuits for breaches of protected health information. Also, the Federal Trade Commission has become involved under the Health Breach Notification Rule, and they're actually probably the most active enforcer on the federal level right now of health information data breaches. So we have a lot to talk about at this conference. My main focus will be on HIPAA, and also my main focus will be on explaining generally what HIPAA is and looking at some very key steps to begin to get your program, your organization, compliant with HIPAA, not only to protect your organization, but to protect your patients, the people you're serving, the reason that you got into this profession in the first place. Well, substance use disorders are covered by HIPAA in that they involve what is called protected health information. However, information about substance use disorders is it's considered to be very sensitive, and it is covered by another part of the administrative laws that's not covered by HIPAA. They're commonly known, is referred to as Part 2. And Part 2 has not been in sync with HIPAA. And the requirements for maintaining the confidentiality of sensitive information that is protected by Part 2, and this is substance use information, are much more protective, although HIPAA is very protective. And what has been a concern for a long time is the and recognized need to bring Part 2 and HIPAA into to synchronize them. And actually, there was a federal law passed 2 years ago that mandated that. And the Department of Health and Human Services is basically over both of those sets of regulations. And they have on February 8th announced the final rule that will help make the the substance use protection rules more consistent with HIPAA. For example, and we don't have the fully published final rule yet, but for example, there will be a requirement for a HIPAA-like notice of privacy practices. There will be a requirement to follow the HIPAA breach notification rule. I can see a need for the prominent posting on the website, which means on the homepage of the website, of the notice of privacy practices, and it's often not done. When I have found a notice of privacy practices, I've seen notices that are not do not comply with the requirements. The requirements are spelled out in HIPAA. They are what are called implementation specifications for all of these different parts, and they're really easy to follow. And we can do that. Another thing that I noticed is the governmental organizations like counties that maintain behavioral health programs and substance abuse programs. And the concern that I have there is that the counties really need to declare themselves as what is called a hybrid entity. And so what that means is singling out and having a documentation of what parts of their county are covered entities, entities that are subject to HIPAA. And if that is not done, then that means that the entire county is subject to HIPAA. And that can lead to tremendous problems for the counties. But the basic thing that I'd like you to come away with is to understand what a HIPAA compliance program is, why it's necessary, and how to set one up, how to go about it. HIPAA is a process, and HIPAA compliance is based on behavior. And you'll see a lot of products or services that are advertised as being HIPAA compliant. No product or service is HIPAA compliant because HIPAA compliance depends on your behavior. Are you following the HIPAA rules when you're using that product or service? So simply having a certified electronic health record system, it doesn't mean that your organization is HIPAA compliant. What is necessary is to is to set up your HIPAA compliance program, which is really based on one thing, which is the analysis of the risks, threats, and vulnerabilities that are specific to your organization that can cause a user disclosure of protected health information that isn't permitted and that is actually harmful to the patients. And then have policies and procedures in place that address the specific threats to your organization, the risks that you've identified, and train your workforce on HIPAA compliance. I have seen on the websites that I've looked at in Washington and Oregon, some forms for patients to fill out to receive copies of their protected health information that do not comply with the HIPAA rules. And one of the things that the Office for Civil Rights is enforcing very heavily right now is the patient's right of access to their own protected health information. And when it comes to behavioral health, there are certain things that a patient cannot get, and those are uh, identified and defined as psychotherapy notes. But there is a very specific thing that you must do if you are keeping psychotherapy notes, your own notes about your interaction with the patient or with a group. They must be segregated from the patient's main file. And if they're not segregated, then they do not meet the definition of psychotherapy notes. And when patients request access, they're not entitled to get your notes about the patient, and they are entitled to receive a response that says, "We're giving you these. We are withholding certain information, and this is why." And also, they need to have be informed of their rights to appeal. So there are bits and pieces of HIPAA steps that you need to be able to follow. And if you have the right information and you have access to it, you have access to the forms, gosh, you can do it. You'll be protecting your organization and protecting your patients.